since coronavirus disease 2019 or COVID-19 was first recognized in December 2019, it became increasingly clear that older persons are much more likely to experience much more severe illness. However, younger persons are also at risk of developing severe COVID infection. And we were interested in understanding whether there were specific characteristics in these younger populations that might predispose them to developing more severe illness. And so that was the rationale for our research study. My name is Jennifer St. Saver. I'm a professor of epidemiology at the Mayo Clinic in the Mayo Clinic Division of Epidemiology. And our paper is entitled Factors Associated with Severe COVID Infection Among Persons of Different Ages Living in a Defined Midwestern Population. And it will be appearing in the Mayo Clinic Proceedings. In our paper, we describe the initial evolution of the COVID-19 pandemic in our local region. And the reason that we describe the local evolution is because it's really important to understand that the pandemic is playing out in different ways in different populations across the United States. In our local population, we focused on persons living in a defined 27-county region of the upper Midwest, east and central Minnesota, and also west central Wisconsin. And we describe this population using the resources of the Rochester Epidemiology Project, which is a consortium and a collaboration between multiple healthcare providers, including the Mayo Clinic, Olmsted Medical Center, Olmsted County Public Health Services, and Zumbro Valley Health, among other providers in our region. Together, we share data to describe the health of our local population. And so we were an ideal environment to really describe and characterize the COVID-19 pandemic in this region. We were very interested in understanding the factors that impacted particularly younger people who developed severe COVID infection in this area. We found that overall, just as in other areas, persons who are older were much more likely to develop illness that led to hospitalization or death after COVID-19 infection. However, severe infections also occurred in these younger populations. So in this population, we found that younger persons under 45 years of age, who had bowel disorders, cancer, chronic neurologic disease, also diabetes and hyperlipidemia, as well as hematologic disorders, ischemic heart disease, and other endocrine disorders, were much more likely to be hospitalized or die due to COVID-19 compared to younger persons without those conditions. These conditions are flags for us to take a look more closely at these younger populations with these conditions to better understand why younger persons with these conditions would be more likely to end up in the hospital or die due to COVID-19. In terms of patients who have these conditions, we need to recognize that, of course, all patients are at risk of developing severe illness due to COVID-19, but persons with these characteristics may be especially high risk. And so the best thing that you can do as a patient is to get vaccinated against COVID-19 infection. The next step in the line for this line of research for us is really to explore in more detail some of these populations, these younger populations who became severely ill, to better understand whether it's a characteristic of the condition they have, or perhaps it's associated with some of the treatments. For example, persons with cancer are frequently have to take immunosuppressive drugs to minimize their cancer, and immunosuppression could be a significant risk factor in progressing severe COVID infection. Another unusual finding that we saw that affected all age groups is that persons with severe personality disorders, such as schizophrenia, or some developmental disorders, were also at a high risk of more severe infection due to COVID-19. And it's unclear why those populations would be at a high risk. And so that's a future line for us to investigate as well. This information and further details are available in our Mayo Clinic Proceedings article, and we invite you to review it and read it in detail. We also look forward to keeping you posted on our future findings in this space. Thank you.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.